Hello, CV Academics and AMP Honors Program. I'm Riley, and I just got home from my first day of clinical apprenticeship. I'm in a family medicine clinic throughout my M1 year, just a half day per week. So I met my preceptor today, and everything went pretty well, I guess. Today was mostly focused on just kind of shadowing and getting used to the flow of things, and as we go on, I'll definitely get more involved. And get to try some more things. But like I said, today I was just kind of following him and asking questions when they came up. And I started off today actually, and I drove to the wrong clinic, so that was not so good start to my first day. But luckily I was way ahead of time. We had planned to meet up like 15 and 30 minutes early, anyways, to just kind of get to know each other. So I was still over 10 minutes early, I guess you could say, to meet my preceptor. So ultimately not a big deal, but just kind of an embarrassing thing. We saw a total of 6 patients in our 3.5 hours together today. And a lot of them were just kind of like checkups and stuff like that. There wasn't anything really acute. There were a couple diabetes patients we saw early on, and they just kind of had similar issues, just like some like peripheral like numbness in their feet primarily, and then one actually had like a kind of nasty ulcer on one of his feet on the top of his left foot that he had surgically repaired. I want to say it was like 2 months ago, and it's looking a lot better now. We did a little checkup on that. He had all the pics for us. He had a phone appointment with one of his patients who was dealing with some substance abuse problems, and that went well. Apparently he's doing a lot better. Then we had just a routine kind of physical, like a sports physical, on a young man starting high school. So that was good. And then the last patient we saw was actually, I think, the most interesting case. She's been, over the last month, she's been dealing with like some right forearm. She described it as like tingling and pins and needles, kind of starting at her elbow and then going all the way to her fingertips. She had a history of a hairline fracture in her right humerus, so that same arm from pitching in softball. She's a big softball player, and so she has a plate, and like I think she said 11 screws in that right humerus. 4 weeks ago she had it come back, and she said it was as bad as ever, and she correlated it. This was her first year coaching softball, and she said she's been using that arm a lot more. My preceptor thought that it might have been some after a physical, he kind of was palpating different parts of her elbow, different parts of her arm, and seeing what kind of reproduced the pain and stuff like that. And thinks that it was kind of like what he called an ulnar nerve entrapment, or it's kind of a similar thing with carpal tunnel, but he said it's cubital tunnel syndrome of the elbow. And he wasn't sure if the plate had anything to do with it, but he said it certainly could be a factor in the entrapment, I guess, or in the pathology of it. And so he referred her to a new doc in the system, a PM&R doctor who specializes in neuromuscular kind of diseases, and PM&R is pain medicine and rehabilitation. He mentioned that she might be able to get an electromyogram, which is kind of like from my understanding, this is new to me, but it's like they send electrical signals, kind of like little jolts in the arm, and they time how long it takes for the sensation to get from the elbow area to her fingertips. So I think it's testing nerve function and stuff like that in the arm. So I thought that was really interesting. And it was cool how he kind of described to the patient. He brought up like a picture of the elbow and all the nerves in it, and brought up why it might be the ulnar nerve entrapment kind of thing. And it made a lot of sense to me, and I thought he did a good job explaining it in kind of layman's terms to her. And so yeah, that was kind of the summation of my first day as my clinical apprenticeship.